Hello, everybody. Today I'm going to be presenting on a disease called Creutzfeldt-Jakob disease. So this disease is a degenerative brain disease that attacks the normal prion proteins in your brain. So here's kind of the overview of what I'm going to be talking about. So first I'm going to be talking about what CJD is and how it affects people, the causes of the disease, the pathophysiology, the symptoms, the prognosis, the treatment options, research, and the different challenges that come along with CJD. So, what is Creutzfeldt-Jakob disease? So, CJD is a rare degenerative brain disorder that affects about 1 in every 1 million people per year. CJD is a type of prion disorder, which is an infection of misfolded proteins that alter the brain function and damage properly formed proteins. So, CJD can be caused by unknown causes or it can be inherited. So what are the causes of it? So there's three main factors that can cause CJD. So there are environmental factors such as consuming bad types of meat, such as, bad, like an infected poultry or red meat such as beef or elk or things like that. So that's one side of the coin that can cause it, and the other is completely spontaneous. So this is where there really isn't any reason as to why, it just randomly occurs. Then there is acquired, and this is where people are infected typically by the disease. This is more commonly found in older cases, typically in the early 19th century, when sterilization of equipment wasn't the best. So you can see that there are some cases where patients would go in for one routine surgery and then find out that they have this essentially brain eating disorder because the patient before them had it and the equipment wasn't properly cleaned. The final one is genetics. So CJD can be passed down genetically from family to member to family member. And this accompanies for about 5 to 15% of all the cases that we see. So the pathophysiology. So the misfolding process with CJD is the prion proteins are normally folded in the alpha helix position, but with the infected prions, the proteins will alter to the beta helix position, which causes damage to the brain and the spinal cell tissues. So the impact of the misfolded prion proteins is that once they reach that beta helix position, it'll cause cell death in the areas of the brain that that protein is in. So autopsy reports from patients with CJD basically describe the brain as Swiss cheese because there are physical holes in the brain where these beta helix prion proteins developed and they destroyed and damaged that part of the brain. So what are some of the symptoms that we can look for? So the initial signs and symptoms are going to be anxiety, depression, memory loss, impaired thinking. So a lot of things that could be related to other diseases. So a lot of misdiagnoses can be done there. So mid-stage symptoms, this is typically where the majority of the diagnosis come from. So we can see blurred or worsening vision, weakness, loss of balance or coordination, involuntary jerking movements, things in that nature where things aren't going right. So typically MRIs, CT scans, those are done to see what's going on. In the final stages, so in these final stages, we're going to be seeing that patients have the inability to be aware of their surroundings. They're typically completely bedridden and they're requiring around-the-clock care until their inevitable death does occur. So the prognosis and progression of the disease. So the progression, it's very rapid and quick going. So we can see that typically the average lifespan of someone once they have the onset of the disease is typically 3 months to 2 years. The disease prognosis with CJD, the prognosis for the long term is very poor, with a 100% fatality rate and few patients surviving longer than 1 year. So the effects from CJD, since CJD affects the prion proteins in the brain, the patients who are diagnosed with the disease will experience degenerative behaviors in mood, behavior, cognitive, and motor abilities. So what are the treatment options? So currently there is no cure for CJD, so the current treatment option is comfort care to make sure that the final days, months, weeks, years of the patient's life are comfortable. So the current research that is going on right now for CJD. So the first one at the top left, we have PRPSC testing, and this is a study out of New York, and essentially they're taking sheep's blood, which can potentially be a carrier of CJD, and they're amplifying the blood to see the brain tissues and to see what types of genetic material they can find, which is allowing us to further um, see the diagnoses in a quicker and more effective manner. In humans, we can simply do this by doing nose swabs similar to like COVID testing, and they have been proven to be pretty effective. The next one, the top right, so this is a new type of medication that's in clinical trials right now, and it has anti-prion activities, and so the hopes of it is that it can attack these beta helix prion proteins and stop the further development of CJD and progression. This next one, the bottom left, it's similar to the one on the top right, where the prion protein is being targeted. The only issue that they're seeing right now is it's only attacking prion proteins, so it's affecting both normal and degenerative prion proteins. So with more cleanup of the medication, they're hoping that they can see some forthcoming effects from it. Ones in the bottom right, these have all been through clinical trials, and all of them have failed to be effective in any way for CJD, so they've all stopped their clinical trials. So treatment options, even though they're few and far between, they do have a lot of challenges, even with the development of them. So it's really hard because since this is essentially a brain eating disorder, there isn't really a way to regrow brain tissue once it's already gone. And even if there was a way to regrow the brain tissue, there wouldn't be a way to get back those memories and physical characteristics that were lost. So in conclusion, CJD is a very devastating and difficult disease to be diagnosed with and to treat, but with those challenges come new developments and treatments in medications and therapies that can potentially hold the key to a cure for the disease. Thank you so much, and I hope you enjoyed this research.